Medications are another one of the falls risk that we need to assess. Today I'm going to be discussing the medication lists that are on the Healthy at Home Fall Risk Assessment form. In addition, there will be two categories that are not on that form that are on the Beers list from 2012 that I will discuss. The first category is anesthetics. Some of you may think this isn't that important from a home care standpoint because that's done in a doctor's office or in the hospital when you're looking at an outpatient procedure. But if we look at the word anesthetic, it is the reversible loss of sensation that you would experience when you're doing a procedure. So the reason I think we have it listed here is that we need to plan to reduce readmission. So if we can do education prior to a patient going to procedure, that may reduce the chance of them going back into the hospital. So with these drugs, they won't be taking them in the home, but you do need to discuss with the patient or caregiver anytime they are told of an upcoming procedure. They need to notify you. In addition, when they're planning for that same day surgery or procedure, and the procedure could be something like a colonoscopy, the patient may think they are fine because they feel fine right afterwards, but they may need someone with them to help with driving and also to have them move with caution that next 24 hours after one of those procedures. The next category includes cathartics and diuretics. Cathartics and diuretics increase the frequency of going to the bathroom and can change the electrolyte balance. Cathartics are substances that accelerate defecation, and diuretics are going to increase the urination. Both carry risk of electrolyte imbalance and dehydration depending on how frequent they are going for either of those medications. Some of the other side effects that you may have with that are hypovolemia, so you have less volume, and then also changing with electrolytes. You can have too little potassium or too much potassium. Too little sodium, for example, can cause a lot of CNS symptoms. So you can have some of that feeling where the patient's not all together. They're lethargic, and so you have some of those symptoms that you need to be careful with. They may have more trouble with walking and balance if their electrolytes are off as well. The next category is antihypertensives. And the reason we're looking at these is that they may cause some dizziness. Some of the medications actually cause dizziness. And also just looking at hypertension, and when you're trying to regulate the blood pressure, that you may have orthostatic hypotension, which is when you get up too fast from a sitting or lying down position, or you may have just regular hypotension where if the blood pressure is dropped too fast on a patient, they may have their blood level drop and they may have a dizzy spell due to the blood trying to go from the extremities up to the brain, and they will have the extra risk of falling. The next category is hypoglycemics. With hypoglycemics, and in addition to that category, you have sliding scale insulin, which is on the Beers list as well. And this is because when you're trying to regulate the blood sugar, if someone becomes hypoglycemic, which is when they have too little blood glucose or low blood sugar, they may have symptoms of fatigue, weakness, dizziness, ataxia, which is the incoordination of, which sometimes is even called drunkenness, where they can't coordinate their movements. So with those, if your blood sugar gets too low, if someone either took too much insulin or if the dose that they were on of the hypoglycemic is too high, it can cause problems with their balance. The next category we have is anti-seizures. These are medications that can also cause some muscle relaxation. We'll talk about benzodiazepines a little bit more in a few minutes, but they can cause the dizziness and the muscle relaxation. Also, other categories like carbamazepine can cause drowsiness and unsteadiness, so you do need to be careful with some of the anti-seizure meds. With the muscle relaxants, which are added to the Beers list now, those, because they're relaxing the muscles, it also can make you dizzy or drowsy or just give that funny sensation and cause you to have some problems with your balance and therefore increase your risk of falling. The next category is a category that we probably most often think about with falls risk in medications, and that is the psychotropics. And under psychotropics, a lot of times we don't think of that word, but we think of sedatives, hypnotics, narcotics, and benzodiazepines. These kind of medications are the ones that we're used to thinking about, that they have the label on the side of the bottle that say increased drowsiness or dizziness. When you look at these, you look at, for example, the sedatives. That's a medication that is going to induce sedation or sleep. So that's usually even the reason that a patient is taking it, so they can have a staggering gait or just the sleepiness. Hypnotics, the same type of thing. It's going to induce sleep. That is the main reason that a hypnotic is used. And then for the benzodiazepine, you're going to have ataxia, dizziness, drowsiness, cognitive impairment, and muscle relaxation. With narcotics, we're definitely used to that, giving that sleepy kind of effect as well. The next category is antihistamines. Those we need to be careful because they're in a lot of the over-the-counter medications, so you may not see it on the patient's bottle that says increasing sleep or dizziness, but you may, it would be on the bottle label. A lot of people just don't look at that. And a good example of that is the diphenhydramine, which is one of the brand names is Benadryl, and that is actually put into a lot of products, even some of the cough and cold, to have someone help sleep better when they're having problems, or with allergy management. One of the side effects of antihistamines is the anticholinergic effect, which is what we'll go into next. The anticholinergics are substances that block some neurotransmitters in the central and peripheral nervous system. And the biggest thing, instead of learning what those exact mechanisms of the anticholinergic medications are, just to know that they can cause orthostatic hypotension. And so, as we talked about before, if you have a low blood pressure when you stand up too quickly, you have to be careful and move slow, so to decrease the risk of falling. The other things that you can have with anticholinergic drugs are the ataxia, which again is that's the loss of coordination, and this is due to the lack of voluntary coordination of the muscle movements. You may have disorientation. You can even have some double vision occur. So that's the main list of medications. I did provide, you'll see it in one of the handout, this was done by UNC Chapel Hill, where they had a list of common prescription medications, and it's got the generic name and the brand name. This is not all inclusive of the medication classes we were talking about above, but it does include a lot of those. It just addresses the prescription medications, not the over-the-counter. So especially be careful with the over-the-counter sleep medications, allergy medications.